Is Cleo still there? It says on my thing we're live in 60 seconds.
I'm going to turn my camera off. You're not live yet.
Okay, yeah, maybe if you could put in the chat box when we're live, that would be helpful. I think we're live now, are
we? No.
Not yet.
Just coming.
Put in the chat box when we're live, that would be helpful. Okay. Hi, everybody. Thank you for joining us. Sorry if we're just having some technical issues as we get started tonight. This is International Nurses Day, so happy Nurses Day to everyone who's joining us this evening. We really hope that you find tonight interesting and inspiring. We've got some really great nurse activists and leaders from UNISON and elsewhere to talk with us tonight for our event. Thank you to everyone who's joining. My name is Stuart Tuckwood. I'm the National Officer for Nursing at UNISON, and I'll be chairing our event tonight. Obviously, the theme for tonight's event is around empowering nurses to lead, because the theme of International Nurses Day this year globally is a voice to lead and a vision for change for nursing. So we're going to spend a lot of tonight talking about leadership in nursing and what's happened over the past year, and also how we can empower nurses to lead over the future with some of the big challenges that we've still got to face. But I think it's really important before we begin that we obviously acknowledge that the context of the pandemic has been incredibly challenging for nurses everywhere over the last year. Despite things improving here, thank you so much to the vaccine program and to the work that everyone's done. There's still large parts of the world that are really, really struggling. And I'm sure everyone who joins this call tonight probably has someone that they've lost, or someone that they know they've lost through someone else over the last year, who would maybe like to take a few seconds to remember them. In UNISON, in our nursing family, we've sadly lost several nurses, healthcare assistants, and other members of our nursing family. And so I'd like to invite everyone who's with me to maybe just take a minute to remember them in silence, and then we'll move on with evening. Thank you. Okay, thank you all for joining in that. It was, I think, really important for us to acknowledge that as we start the evening. So we've got a really fantastic group of UNISON nurse leaders and activists and other nurses to join us tonight to talk about leadership. So I'm going to go around and quickly introduce them all to you before we get cracking. So firstly, I'd like to introduce Anjani Sitaran, who's a diabetes specialist nurse who's led a really interesting program over the last year. So would you like to say hello, Anjani? I think you're still on mute, Anjani. First one of the night.
Thank you. Thank you for this opportunity to share my views and take part in this discussion on International Nurses Day. As I said, my name is Anjani Sitaran, and I work as a diabetes specialist nurse with the Brent Integrated Diabetes Service at the London Northwest University Healthcare NHS Trust. I also received a Mary Sickle Development Award in 2019 to focus on people with type 2 diabetes on insulin amongst the Black, Asian, and other ethnic minority communities at GP practice and community diabetes clinics. Thank you.
Thank you. Thank you so much for joining us. And we're going to hear a bit more about that program and your award as the evening goes on, because that's a really interesting example of nurse leadership and innovation. So we can't wait to hear about it. I'd also like to introduce UNISON's National Student Nurse Lead, who is Joy Gorman. Would you like to say hello, Joy?
Hi, Stuart and all. Thank you for having me. And of course, it's been wonderful
working with you all as the student learner voice, and it's a testament to how brilliantly Unison supports student nurses and peers of myself. It's been a really interesting roller coaster the last year. I'm coming towards the end of my degree and soon to qualify. And during my degree, I've seen some great examples of innovations in placement with education and learning, where students can add quite good value and new innovation in practice when that's embraced really well by teams. There's a great culture and just great leadership as well, the way we're welcomed and supported on placement, and of course areas where leadership could improve. So it's a fantastic theme tonight and delighted to be here. Thank you.
Yeah, Joy's had a really interesting experience over the last year, helping us lead for students in Unison on all the issues that have affected students. And also, obviously, you've been on placement yourself during the pandemic and learned lots throughout the last year. And we've also got some great news that you've received today, haven't we, Joy? I'll let you announce it.
Yes, I found out on International Nurses Day that I have been given my first post. I'm going to be a cardiology nurse as a newly qualified nurse in just a few months' time. So I'm absolutely thrilled, and I'm going back to a wonderful team where I was a band 4 aspirant nurse supporting during the COVID-19 pressures, and it's a fantastic field. I'm delighted. Brilliant news.
Congratulations from all of us at Unison. It sounds like a really great first job, and I'm sure they'll be really lucky to have you. I'm just wondering if we can ask you to delay your graduation so you can keep on supporting us for a little while longer, but it's probably not a good thing to do. No. Okay, thank you. We'll hear a lot more from Joy as the evening goes on. We're also really lucky tonight to have the elected chair of Unison's National Nursing and Midwifery Committee, who's Trudie Martin. Would you like to come and introduce yourself, Trudie?
Thank you, Stuart, and congratulations, Joy. You're going to be missed from our committee. My name is Trudie Martin. I'm very grateful to be the chair of the Unison's National Nursing and Midwifery sector. My background is I've been in the NHS for over 35 years. I started off my career as a meagre nursing auxiliary that managed then to achieve our MVQ level 3 when we first could as a nursing assistant, 25 years in a community hospital in Devon. I then was one of the first people to do my assistant practitioner training, which was absolutely life-changing for me. It gave me the confidence confidence and competence to be able to do what I do today. And then moving forward, I then became a little bit more active in Unison because I was absolutely fed up with not being taken seriously in my role, being totally abused and used whenever they could dump me into a role that wasn't scheduled. So that's why I'm here today, still fighting the fight to ensure that all our support workers are supported and recognised for what they do.
Well, that's the way it goes with Unison, Trudie, isn't it? You take up one small position and before you know it, you're chair of a national committee.
Yes.
Yeah. So Trudie, as chair of our committee, has lots to do with nursing and midwifery policy, helping us represent the whole nursing family's view within Unison. But also, obviously, Trudie, you at times during the pandemic have also gone back to helping clinical practice, despite normally being the chair of your local staff side. So
Yes.
we'll have an opportunity to talk to you a little bit about what that's been like as the evening goes on. Thank you. We unfortunately we were due to be joined by Gamu Nyasoro, who's another nurse in Unison and a member of our national committee, but she's unfortunately come down with laryngitis. So we all wish her that she gets a speedy recovery. It's probably not the best thing to do to sit talking all night on an event for International Nurses Day. So hopefully she gets better soon. We're also going to be joined very soon by a fabulous Unison rep and nursing apprentice, Carley Kane, from the north of England, who is a really, really inspiring nurse leader at her local level, doing loads of different activities and things to speak up for her colleagues in nursing. She's so dedicated that I think she's still on some other event at the moment for International Nurses Day, and will be joining us a little bit later on in the evening. So tonight is a chance for us to talk about all the amazing things that nurses have done in leadership throughout the health service.
Stuart,
yeah,
Carley's there. She's here.
Oh, is she here? Okay, I couldn't see that. Oh, well, would you like to come and say hello, Carley?
Yeah, sorry, Stuart. Yeah, so yes, fine. My name's Carley Kane. Huge congratulations, Joy. That's wonderful news. I was so happy when I saw that today. So very well done. Yeah, so much like Joy, I'm just at the beginning of my nursing journey, but it kind of feels like I've been around a lot longer than just kind of 2.5 years. And like Stuart said, I'm very interested in leadership, and as we know, it's important at all levels in nursing, regardless of your nursing band. It's really good in terms of being a positive advocate for your patients and your colleagues as well. And something that I feel passionate about is nurturing our staff, our colleagues, because we do know that, you know, when we work in the NHS, it's like a second family, because we go through so much together. So I think it's really important to just nurture everyone. So yeah, it's brilliant to be here tonight. So I'm looking forward to it.
Absolutely. Thank you for joining us. I'm sorry I didn't see that you'd joined us yet, but it's great to have you. Yeah, Carley's done some really amazing things and some really great work locally. And as you've said, that's a really good point. Nursing leadership occurs at all different levels, all different roles throughout the health service. And God knows we've called on everybody in the NHS over the last year. So tonight's a really good opportunity for us to reflect on what that leadership means and how it works and how we can help nurse leaders at all different levels as we go forward. So that's how we're going to begin tonight. We're talking about leadership and about change and innovation. Over the last year, obviously, the health service has had to change and leaders have had to show that what they're worth at all levels to help us cope with the COVID-19 pandemic. Not only have nurses been leaders in terms of managing to reconfigure the health service and change the way we do things to enable us to cope with the huge rapid influx of people sick with COVID-19 that occurred many different times throughout the year. They've also helped lead programs in research that's helped us find cures, find treatments for COVID that have improved people's chances of surviving, that have helped us understand how the disease works. They've also designed, led, and implemented the vaccination program, which has been an astounding success and has enabled us to begin to hopefully see an end to the pandemic in this country. And I think the last time I checked, we passed over 36 million doses of vaccinations given in the UK, which is a really incredible achievement and testament to hard work, but also leadership skills and talents of nurses and obviously all other healthcare professionals and healthcare staff around the country. There's also been a really interesting amount of change and innovation that has enabled us to cope with the huge change in the way we've had to do things throughout the pandemic. And that's one reason it's good to reflect tonight on all of that that's taken place and what we can learn from that. UNISON sponsors the Team of the Year Award at the Nursing Times Awards. And Trudie and myself were really delighted this year to be able to give the award to a nursing team from Mary Stopes International. We'll share some information on the webpage, etc., that people can go look at about this team, but they led a really fantastic example of innovation during the pandemic. Back in March last year, when obviously the country went into lockdown, suddenly we had to reimagine how we were going to provide healthcare to lots of different people. And Mary Stopes International obviously provides support to women at home who are in pregnancy, who might want to go forward with termination or who might need other support. And suddenly they went from having to provide that through clinics and appointments to having to do that all online and manage a completely different service. And they led a really, really amazing program of work. And I know they worked fantastically hard to make sure that all women they were supporting were still able to get support and get help during the pandemic. And it's a really interesting example of nurse leadership and how teamwork can help us meet these really difficult challenges when they come up. So that leads me really into our first kind of discussion tonight, which is about leadership and innovation and all the things that's happened over the last year. So I'd like to start by bringing in Anjani, if you don't mind. I'd like, if possible, you could tell us a little bit about the project you've been working on for your Mary Seacole Award, and tell us a little bit about how that's worked and how you think you've adapted to use technology and do things differently to meet the needs of the patients in your community who I know can be quite marginalised.
Thank you. So the Mary Seacole Development Award project, I had to pause it because of COVID-19. The project was focused on targeting people with type 2 diabetes on insulin and at a specific ethnic groups in their own language to discuss their cultural foods and how to manage their blood glucose levels. And it was designed to do face-to-face group sessions. But as you know, due to COVID-19, it changed to virtual. So then now I had to think of how to reach the people, how to manage reaching out to everyone with diabetes. So the first step was to call people on our caseload, but also to look at a population-based approach. And this is looking at all the people registered in the borough in using the local dashboard data. And I use it, it's comparable like a ward caseload. So each GP practice, people with diabetes on that register was look like a ward caseload. And the joint clinics with the practice via Microsoft Teams was looked at as a virtual ward round. So here we were able to assess people's needs, provide appropriate care, identify who was the priority, who required services, and looked after people during the COVID time. So people who were who had COVID, trying to keep them home and just reassuring them. So another thing that we did was try and encourage people who had IT to upload their blood glucose levels so we can view it remotely. So that was another difference that we use. So we continue to work throughout the pandemic to reach the patient needs using evidence-based care, really.
So what was the experience like? Because obviously you're used to doing this face-to-face interaction with people in group education. Suddenly you're doing it all from home. Well, what was it like for you as an individual? Did you find that really challenging?
Well, for one, we never had a laptop to work from home. So
Okay.
For me, it was going to the office alone and using the computer at work, calling patients from work until it was about nearly a month later, we got laptop to work at home. So initially it was setting up the system. Actually, I spent the first few weeks setting up the system, communicating with the GPs, communicating with patients. I thought we did manage to reach, and then also supporting colleagues. It was a lot of discussion while everybody was in this, what's happening? How do we reach the patients? And then we just rejig our service. We were able to get laptops and then phones, and then we could work at home. But we were still going out at least one day for those people who didn't have mobile phones, for example.
That was going to be my next question. Yeah.
Okay. Yes.
Yeah. So I mean, how did you get around that with people who maybe struggle with technology or who didn't have access?
So a lot of phone calls, because if they had a house phone, we would call them there. But the people who didn't have smartphones and they needed to, like, for example, check their blood sugar level, they would say probably go to the pharmacy. But yet they struggled. And so those people will bring them in. Of course, shielding, PPE, everything was in place by then. So we could say come in on that occasion. For people who were struggling, like, for example, with their insulin and titration, those would be the specific people we would call in.
Yeah.
So it wasn't bringing in everyone, but tailoring it to the need of the people.
That's interesting. Yeah. So you had to make big changes, obviously, but you were still able to make sure that those people who needed individual support still got that, because you're working with quite what could be described as a marginalized community, aren't you? That quite affected by health inequalities. So that must have taken quite a lot of dedication to overcome that.
It was, but we work really closely with the GP practices. Once we got Microsoft Teams going, we were able to do three-way consultation with the GP practice and the patient. So, and now we are getting feedback that actually patients quite like this like virtual, because they can actually do things, and where we were struggling sometimes to provide education, now it's easier because they can just log on. They've managed to develop themselves for the past year with the technology. Yet we have a cohort of people who is not tech IT literate, and those people we still need to do that one-to-one with them. Yeah,
I think so. So there are some people who actually embrace the change and who think, and you've said this to me before, that you think there are some advantages of doing it this way. So it's forced you to maybe do things differently, but you've learned some things from it.
Yes. So it is I mean, the learning is that we use IT, yeah. So we could use IT. We still can meet people's needs differently. The way how we were working before need to change. So that is something that we would look at. And yes, I think just last year, just working with people, their feelings, discussion. For me personally, it's stepping back and listening to people, their views and how they manage their diabetes. So it's stepping back and getting people at forum to talk to.
Yeah, because that's interesting, because it's not just the way you're doing things that have changed. It's so much else in their lives has changed. Obviously,
yes,
they're not just dealing with doing their healthcare differently. They might have lost their jobs, or their job has changed, or their children's schools are shut. So do you think you've probably you've been a source of contact for them, as well as being someone who's giving them education?
Yes, and also directing. So we do Desmond education, and we have started that as a group, the whole team, virtually. And uptake has been really good. People have been logging on, when before it was all face-to-face. So there's support, and it's also directing people to, like, for example, talking therapies and giving that information so people can actually go to the right services. So, and also for me personally, is also linking up with the local council when they have their meetings. Now it's easier. You don't have to travel to a center. You can log on and you know what they're planning for people with diabetes. So it is tapping into all the other services in that role of leading this project, leading the service, and being there to actually make the change.
That's really interesting. Yeah, thank you. And one thing that's come through very clearly is teamwork. Obviously, you've talked about working with the council, but working with your GP practice and also your immediate colleagues when you began. So
yes,
we'll come back to that a little bit later. But thank you for that explanation of your project. I should add that if you're watching on YouTube and you have questions for Anjani or any of our panelists, or contributions or stories that you'd like to tell about leadership and change, you can put those in the chat on YouTube, and we can discuss them on the live event. I'd like to go to Carley now, if I can ask you, Carley, a little bit about your work and how that's changed, and I mean, what it's been like for you and the people around you in terms of trying to lead the change that you've had to adapt to over the last year as well.
Yeah, I think everybody's just adapted really well. And I think the thing is, we've all been through this together. And like what you touched upon before, there's a whole different picture behind like what's going on. So even with some of our colleagues, they might have, you know, partners that have lost their jobs. So that's when I was saying before about, you know, just looking after everybody. I do think it's been really important, and I do feel like, especially where I work, like the senior management have really nurtured the staff and kind of led the changes really well, and just making sure that there was just compassion all the way through, because it must have been very challenging for managers, you know, kind of putting everything in place and opening up new wards and things like that. But I think because I'm so early into my career, I think I was able to adapt quite easy. Okay. So obviously I qualified as a nursing associate last April, and I feel like, taking the positives from it, I think it's definitely made us feel that if we can nurse through this time, then, you know, and still have the love for the profession, and still feel like we absolutely would not want to do anything else, then that is a good thing. And I think the teamwork has just been phenomenal, not just in my own teams, but the whole organisation, and things that we've seen on the media, and just support for each other, that has been really important. I know, like myself and colleagues, we were like sending gifts requests to each other. Just, it's been different, hasn't it, the communication element, but we've adapted to it really well. And what I've said in some of the future nurse sessions that I've done is, I think the biggest change has been communication. And I think before all the PPE, I think I took it for granted the way that we would communicate with each other, even our own families, you know, like taking a hug for granted, because I think we all were guilty of that. And I think now it's amazing that we're learning that, like, I think you can smile with your eyes. So I still think even when you've got that mask on, you've got the PPE on, patients seem to still feel, you know, like, I think you can tell a lot by someone's body language, their eyes. So it's just, it's been different communication.
Well, that's interesting. It's a really good point to bring in, because, you know, we're going to talk about technology and innovation and changing the way services are run, but you know, something we may have learned, you know, really the hard way over the last year and a half, is that compassionate leadership and the difference that makes. And I've seen some, you know, brilliant, and heard of some brilliant examples of good leadership over the last year and a half. You know, sometimes some bad cases of leadership where people have tried to lead change and not brought people with them, or not been fair or kind to them at the same time. And I've really noticed the difference to the way that's made people feel. And when I was working clinically, even like you said, in all that PPEs, just having someone come around, one of the managers or the leaders, to just check, and just, there was a lot of the time, there was nothing they could do for you to make the situation any better, but they could still ask and acknowledge how you were feeling, and that made a real difference. So that's something you've noticed that people have done really well.
It definitely does. It keeps the morale up, and especially, you know, for myself and probably Joy, when you're new into the profession, you do look to your seniors as role models. You look to them for the guidance. So having that is really important, and then it's a good example for us to have as well of, oh, this is how it should be. This is good communication. This is how to look after and nurture the group. And then not only do you get the best for your team, but patients benefit. So I do a lot for Civility Saves Lives. It was a campaign that I was involved in, and evidence does tell us that it is right. Civility does save lives. There's evidence that supports that. So yeah, it's really important for patient safety as well.
Yeah, I know, and obviously so many nurses and members of our nursing family will be struggling with their mental health at the moment and over the last year, and the difference that being kind to someone can make all the difference, can't it? So
absolutely.
That's really interesting, Carley. Thank you. So on that note, I think I'll bring in Joy, because Joy, moving on to talk a little bit about more, I think what Carley started us off in this discussion, what does make a good leader? You entered the workforce early as on a paid placement in your second year, then also again in your third year, taking on a lot more responsibility than would normally have been expected of you at that point in your training. Who made you feel well supported, or did they make you feel well supported, and how did they do that?
Yeah, I guess in the build up to it, taking on from what Carley said and Jeannie, in that communication was key. So we had that unfolding before of us, really good communication between nurse leaders and healthcare leaders, keeping students updated on the situation. And yes, there were frustration and delays in not knowing was frightening, but there was really good examples of good communication, leadership, and the breaking down of barriers. All of a sudden, leaders became tangible people that we could engage with via Zoom and webinar, and ask questions directly rather than it coming down through many layers. So even before placement, we were seeing examples of great leadership, great authentic leadership, where we could relate to the person that was telling us what was happening. And then the second thing is, in both placements, my most recent one as an aspirant nurse band 4, that was, I guess, the best one for me, because I was literally thrown in the deep end and responsible for a bay of 4, but not left unsupervised. And we were all given nurse buddies, and that was fantastic. We were on COVID red acute ward setting, and the sense of camaraderie and everyone being in the same boat. Again, there was the breakdown of those barriers that just seemed to build up and make people unapproachable unintentionally. Those barriers were gone. We were all in the same boat. We were all figuring things out together. There was still the kind of leadership statuses, but that status didn't seem to be the same. It was very different. There was greater transparency, greater authenticity. There was an acknowledgement of the difficulties. The staff room where everyone had coffee became a big debrief room for teams because it was so intense, and they were encountering things that you would intend to encounter so much in one shift, like death and family bereavements. And then the leaders would put on debrief sessions, counselling sessions to help those who are exposed to grief more than there would be. And then from top down, we were seeing that self-care, compassion, nurturing, and recognition of burnout. And there's even more focus on that now. And I think pre-COVID, there's a lot of burnout with staffing and nurses and staff shortages, but now that seems to be more prevalent. So there's a lot of things that have come to the fore that I think we need to keep carrying on and not lose sight of. It would be a shame to go back and not lose, to see those barriers build back up again and not lose the momentum that we've all gained. So I guess good leadership for me is about communication, compassion, authenticity. And we were learning in our nursing degree all about patient-centered care, the importance of family, loved ones and carers. And here we were seeing how difficult patients were struggling in hospital, not having that connection, and then seeing nurses creating that connection through whatever means they could, like Anjanine, like the nurses doing the iPads and the FaceTime. So we were literally having the research books enacted out in front of us, and it was a fantastic experience and great leadership. I think that might cover it.
Yeah, there's so much to reflect on. And it's interesting what you say about accessibility, but also this touches on what Carley was saying. And I think although the pandemic has been hugely difficult, there were many difficult situations in healthcare before. You know, we all had really difficult times, and we were under a lot of pressure even before the pandemic began. And maybe we'd gotten too accustomed to that, and we didn't think to check in on people enough and make ourselves accessible and make sure that people could get the help if they needed it. And I think hearing strongly from you guys so far, that's something that we need to make sure stays available. So then, Joy, I mean, that the question back for you, which is maybe a difficult one, is it took a crisis to make, you know, leadership become more accessible and really reach out to people. Do you feel like, are we still doing that? Are healthcare and nursing leaders still doing that? And what can they do to make sure that the leadership remains good going forward?
Great question, Stuart, because I really hope that we don't step backwards. I think going forward, we know nurses are now facing, and services, all frontline staff, a backlog and even more pressure. We know that student nurses like myself about to qualify are going to be quite vulnerable going forward because we've had a very different last year or two. And I just hope that the nurse leaders top down are as keen to engage with us, check in with us and communicate with us and see how we're doing as the COVID-19 preceptees stepping forward and still have that nurturing focus. And on the front line in placement areas, I'm seeing good examples where they are checking in with teams still and ensuring that students are all right. There is a tendency, because everyone is under so much pressure, that you may not want to ask for help as much as you should do, and I worry that those tendencies will kick in and take over again, and people will slip through the net that are struggling. So I think we need to be really vigilant, and as you say, draw on those insights that we've gained and not let the envelopes all seal again and lose those golden nuggets of wisdom.
Yeah, that's very well put. I mean, I worry a lot that, you know, now we can look at the fact that the case numbers are much lower and there's many fewer people in hospital with COVID and go, great, back to normal, crack the whip. We've got the waiting times to get on with. We've got all these other problems to deal with now. You've had your 5 minutes of support. Now we need to move back on with the work. And I think everyone who works in healthcare in the NHS recognises there needs to be a culture change in making sure that people are well supported. And obviously, I'm sure everyone listening in at home wants us to talk about pay. And obviously a decent pay rise to make sure that everyone's valued properly would go a long way towards making people feel good. And you can rest assured that UNISON is doing everything possible to achieve that. If I can bring Trudie in, sorry, Joy, did you want to say something else?
Yeah, I just wanted to acknowledge all the student nurses who have pulled through the last two to 3 years. Well done. And we know you're exhausted. I'm exhausted, and we know we're about to start our new roles exhausted. So please look after yourself and draw on those support networks. But well done. We're almost there, and keep going if you're in year 1 and year 2.
Yeah, they've all done an absolutely brilliant job. You know, those that opted in, those that opted out, everyone has been through a difficult time. So it's really good to put that message out there. So on the subject still of leadership and what's happened then, could I bring in Trudie as chair of our national committee? So you've got a leadership role at a national level in helping Unison react to policy and, you know, and pursue what it is our membership wants us to do in nursing and midwifery. But you're also a kind of staff side leader in your local trust in your region. How have you reflected on your role during the pandemic, the kind of leadership that you've had to show, and what do you think you've learned from that?
Gosh, I think the biggest thing that I've learned is what an amazing group of people that I work with and endeavour to achieve things for every day, because I'm staff side chair of Northern Devon Healthcare Trust, and my hospital is one of the most geographically challenged in England, so we struggle at the best of times to recruit nurses. Most of us, we recruit quite a lot from overseas, and those nurses in particular have needed a lot of extra support during this terrible crisis, worrying about their families back home and not being able to visit them. But I also I'm very fortunate as well. I'm chair of the local STP group, which covers most of the hospitals in Devon. And we in Devon, in Exeter in particular, we were the only place in the country that had the Nightingale Hospital opened for what it was set for, to cover COVID. And that was a huge piece of work, particularly because it was covered by volunteers from the existing staff within the hospitals in the area. So that was really difficult, trying to make sure that they were looked after. The most important thing was, because of the distances that people had to travel, that they had the right accommodation to stay there, because they didn't want to come traveling to and fro. The unit itself was amazing. We had to make sure, and still are working very hard in looking after our staff's health and well-being, and most importantly, making sure that they get their annual leave and take the breaks when they needed to. Part of my work during this, and is still ongoing, is to make sure that staff are protected. The PPE thing hit big time initially, and I spent every single day challenging PPE, making sure people got the right things to wear and and it was a learning curve all the way along. The risk assessments, making sure people had the right facilities to take their breaks. It was really awful. But I think the thing that I reflect on the most is the fear that every single member of staff had, but they didn't show it. They continued to go in every day, supporting everybody, looking after, putting the patient first. Yeah,
there was obviously amazing professionalism that everybody showed. You've touched on, like, you know, partnership work, because we've talked a bit about team working and clinicians working together, but what we also saw, and that maybe people on the front line or you know, lots of different clinicians didn't see because they were so busy doing the everyday job, was the huge work behind the scenes that was going on with trade unions, partnership organizations, healthcare employers, to try and ensure that we could respond to the situation and protect people as much as possible. And I think Carley and Joy have mentioned this kind of melting of some of the hierarchies that happened and how we just reacted to things quickly. You must have had to do loads of that locally, Trudie. And
yeah,
what part of that do you want to keep going forward?
Well, I suppose that for me is I've never been involved in so many strategic meetings ever.
You probably don't want to keep that, do you?
Well, it's been a good learning curve, because sometimes people forget. You know, they're given a task to do, but actually, I think it's really embedded what team working is and how big that team is. I mean, we've talked about it tonight about, you know, nurses or nursing assistants, you know, and as Unison prides herself on, we are one team. So I think that's the bit that's focused on. I think the other thing that we need to reflect on, and you know, it's about how we've had to change work-wise. I mean, I know I have to work from home because my office is now used clinically to cover things, you know. It's very difficult when I'm representing somebody as a trade union rep, and at the minute we're not doing face-to-face meetings, so it's that support, but it's making sure we get a good balance of that. And I think that's what we're all going to be learning as we move forward. Everybody's looking at different home working policies to make sure that we get it right, and that we are making sure that people are hopefully recompensed for what they do when they're at home. And nursing has moved on in such a way. I know from where I am in the Southwest, I'm very much now going to be involved in, as we move forward with the people plan, and now we look at diversifying our workforce. I know that we're going to be looking very heavily on nurse practitioners, because particularly down in my area, we've not got medics, so we want to encourage people to go on and train more. Particularly, we want to take on more nurse associates and with the apprentices. So we're just doing big pieces of work on that. So for us, particularly down here in the Southwest, it's lovely. There's going to be lots and lots of opportunities for people. And that's what I want to see moving forward, and to ensure that people are protected, looked after, and that they get the learning and the support that they need.
Yeah, I mean, there's so much changing, isn't there? It almost sounds overwhelming how much there is going on. And I think one of the things we need to reflect on as well is the need to look after people as that happens, because I think in moments like this, sometimes we can rush ahead and try and do too much at the same time and be almost too enthusiastic. And we do need to remember that it can be quite bewildering for lots of people, this change. And I think it's a very good point about the remote working as well. We need to make sure those people are, it's not necessarily just about everyone wearing the PPE at the times, but it's also about those struggling with big caseloads who are working at home and trying to manage all that. So, and you obviously, you worked clinically, you were called upon despite all of that to go and do clinical work as well. How was that for you?
I got to be honest with you in the end, because I was so busy trying to sort out stuff. I was all planned to go into the vaccine centre, and they said, no, we need you to do this. So I didn't end up, but I did support the vaccine programme to make sure that we had the right people. And I'm very proud to say that Devon was one of the, we did some of the highest figures in the vaccine, and that was just making sure that we got the right people in the right places at the right time. And we're still doing that every single day. I'm so pleased to say that we opened our new vaccine centre in North Devon, and I think the first day we did 1,100 vaccines even now, which is absolutely amazing. Yeah,
incredible. Yeah, I mean, the leadership involved in the vaccination program has been immense. It really has. And again, that was a whole, new vaccines, new information, the issues of, did people trust the process, the communication with the public and with patients, and all of that was managed really amazingly by lots of people. So thank you, Trudie. Sorry.
Yeah, my nursing colleagues that I speak to, it is one of the most wonderful things. They love doing it. Today, the nurses that I'm speaking to today, they said it's the most wonderful thing to do, the most happiest places. And I'm so pleased to see that as these younger people are coming in, that they are as keen as anybody else to take that vaccine.
Yeah, and I think we're all delighted that so many NHS staff and care workers have got their vaccines now. I know I felt I wanted to hug the nurse when I got mine, but I wasn't allowed because of social distancing, obviously. But yeah, it's really incredible. I've heard really amazing things from everyone who's taken part in the vaccine program. So thank you, Trudie, and thanks so much for all the leadership you've shown as part of the committee and your work over the last year, because I'm sure all the UNISON members that we've helped to protect appreciate that. And we're going to move on to kind of talk about the future and the challenges that face the NHS going forward. But we've talked to every one of our panelists. But did anyone want to come back in to reflect on something someone else has said, or emphasise a particular point? Please feel free.
Yeah, I just wanted to pick up on Angeline's wonderful innovation work with the technology inside, and just to emphasise the point that she made about patients enjoying that consultation online. And I think there's been a lot of fear of technology and digital health, that you'll get this robotic platform and there won't be any engagement. And there's been a big push in the past to drive technology forward, and there was almost a fear amongst clinicians that it would be alienating patients. And the last year has shown very much good practice and how it can still be person-centred. And I was doing a recent talk with ICU recovery patients, and they were talking very much about the difference between rehabilitation, pointing them to a generic website and just picking out exercises from a video, as opposed to having that one-to-one like Angeline's been providing. So I just hope that that person-centered approach that you've been providing continues, and I'm wondering what your thoughts of that have been, Angeline.
Oh, thank you, Joy. Actually, I used to be a cardiac rehabilitation nurse for 15 years in the community. And it is so true that providing that one-to-one, but you know, it is the teaching skills. Like for example, with Desmond, you use the same philosophy, and you get everybody engaged, and that's it. And people feel they are in the room, like with the small cohorts of people with, for example, the insulin groups. We have a small group, and everybody participate. I think it is not missing that, and giving people exercise, but making sure it's engaged. So you give them an exercise, but they need to feedback. And if they have that feedback and that one-to-one, they feel as if they're moving on. So, I mean, like the trust right now, as we were talking about well-being and looking after people, you know, like Virgin Go now is doing the app. Now we did it in 2019 before any lockdown, and it really brings people together. So it's using that same philosophy of engaging everyone, talking to each other. And yeah, hope that answers your question, Joy.
Yeah, it does. It kind of steers into what you're asking us here, because I think looking to the future, we've such a backlog, we've such a growing demand. We know we need to use digital health and technologies more to help meet demand, and it's just finding that way to do it so nurses don't feel they're losing that person-centered care and patients don't. And your example is a great example of that, and I think we need to be not afraid to embrace that and find ways of ensuring we meet both criteria.
Yeah, that's very,
definitely.
very good.
I think as a student nurse as well, so I'm loving the online content and the distance learning, and yeah, I think it just proves like in a setting like this, we still feel like we're communicating very well and engaged really well with each other. And I think for some students as well, like I was a lot more kind of shy in a big kind of class environment. So it's a really interesting point that patients are adapting well to online tech. And I think for us as student nurses as well, and this is probably going to be the future now, so kind of embedding that in us from this early stage can only be a positive thing. So I think it's really good.
Yeah, I think it's amazing how advanced we've moved so quickly with some of the technology. I mean, I know with UNISON, we've managed to do so much more technologically events like tonight than we would have done before. You know, in many ways, obviously, we'll want to get back to having events and talking to people, but it's brilliant that we're able to make the most of this. And I think that's an excellent point from Joy and Carley and Anjani about how we do that in a way that doesn't exclude people, obviously. So Joy, were you saying something? Do you want to come?
Oh, this is
Anjani. Yeah, sorry, Anjani, and then Joy.
I was just going to add that how also what I find is that people and their families are engaged. So like people with languages problems who would never really come out because they needed someone in the family to take time out. Here we have on the online platform where the family is there and able to translate and have that discussion with them. At least for diabetes, it works really well because the family now is being informed, and they didn't have to take that time out because they're working in the next room, for example. So this part, of course, is going to change, and we have to go back to the element of face-to-face for some people, but not everyone. So, yeah.
Yeah, that's interesting. Joy, were you coming?
Yeah, I was just going to say that it's really important what Carley was saying. Some students have got on fantastic with it. Other students really hate it, and they really miss that lecture experience, the face-to-face, and some feel that they've gone backwards rather than forwards, and it's a matter of making sure we're able to meet both needs and both learning styles, and the same with patients, is offering that physical opportunity but as well as embracing this. I think it's got to be done in balance, isn't it?
I think one of the things that's coming through from all of you is that the human behind the computer and the technology as well, though, isn't it? And I think that's been something that students have said a lot. The e-learning, etc., is great, but it's if you're just clicking on something and sitting there with a kind of impersonal experience, there's a really limited learning you can take from that. Whereas simulation, opportunity to have a discussion and reflection with someone is really important. So although we want to embrace some of these new technologies, you know, maybe we need to make sure that there is still that opportunity for proper interaction behind it, and that's what I'm hearing from lots of people. It's also great to hear from Anjani about that involvement of families and carers in people's care, you know, and that's at both sides of nursing care as well, or some of the different sides of nursing care. I mean, you're talking about rehabilitation and also managing people with chronic conditions, but as I think Joy, you were saying, that opportunity to keep families involved while they were not able to visit their loved ones in hospital was a huge lifeline to, you know, to so many people. I know lots of nurses that were involved in just doing that all day, every day, trying to keep people connected. I was in intensive care at points, and being able to take an iPad, connect to Skype or one of the other video calls. And I was looking after a young man one night who was quite delirious and struggling quite badly. And I thought, you know, almost thought he couldn't understand what was going on. He was completely delirious. And I worried about connecting him with his family, actually. And then when we did, he calmed down almost immediately, and sat there waving at his family, and they brought the cat on and let him say, you know, let him kind of wave hello at it as well. And, you know, just that ability to connect with his family, even just by a video, made a huge difference to him immediately. And I know that was the case for so many people throughout the pandemic. So really interesting the ways we can use technology, and helpful in lots of ways, but obviously with proper thought and proper care. So we've talked a lot about everything that's happened then, and how we've adapted to the challenges and how we've led people through it. So, you know, you guys are going to have to answer some really difficult questions now about what happens next. So we know we've got at the end of February, this year, there was nearly 5 million people waiting to begin hospital treatment on the NHS in the UK, a record high. It's obviously never gone that high before. We've got the challenges of dealing with the aftermath of the pandemic, with people who have long COVID, who are going to require treatment and individualized support as we go forward. We've got the huge level of associated challenges with mental health and stress that have come from lockdown, and all the other problems that have happened. So how can that innovation, what can we take from how we've learned to deal with things over the last year or two, and how can we help that, how can we use that to adapt to the challenges that are coming next and help us overcome those? So Anjani, I don't know if I can bring you back in at that point, as someone who's you know, been on a project doing that kind of thing, to give us your thoughts. I don't expect you to have all the answers.
Okay, well, one thing COVID-19 have highlighted is the importance of health and well-being for everyone.
It's true, yeah.
But one of the things of bringing back nursing innovation is every nurse is thinking about that small change. For me personally, is that small change. What can make that different? How can it help? And those ideas, how we can meet the challenges. Because we are aware we have bigger challenges, which the trust is looking at, and everybody is working towards that. But working ground level is that small change. So using tools, for example, process mapping what the current service is, what it could be like with colleagues, using root cause analysis and plan to study changing what have changed, doing that regularly. And that will help us face some of the challenge, I feel. But also, who do we go with these little ideas, right? And maybe in the trust, there is the Trust Innovation team. They is focusing on what project you'd like to. PCN leads in primary care, the local council, the leaders attend their council forums and share your vision and ideas how we can improve care together, because this is everybody impacted, especially in an area where first COVID-19 was highlighted, is deprivation, yeah, and how we can make that change and engage everybody with those small changes to improve outcomes and reduce the stress. And I would say I'm really pleased the trusts have actually put out for all staff health and well-being sessions. Unfortunately, because of the time and work, I haven't been able to tap in, but just knowing it's there and knowing that resource is there has been really enlightening and uplifting.
And it needs to be accessible, obviously, for you.
Yeah, but I suppose it's accessible for if it's local, because I work in a community setting. That's why it's not local to me. But if you're working in hospital, it is quite local. It's quite there. So that is the difference. But there are other we direct patients, you see, that's the thing. We direct people to the local area of where they can get access to online, for example, activities, exercise. Those are the things that we will direct to. So it is us also using resources. So
learning how we become networked and connected better to help our patients.
Yeah. As I said, it is really the small changes for me. It is using that small change. Like for me, when I went to Mary Seeker interview, was like, I had this idea of making that small change. And this was before COVID-19, of seeing people with already on insulin being treated, but their blood sugar is really high. How can I make that change to meet more people? And this way it will save the cost. I think it'll be more cost effective, looking at people in group setting, more efficient use of resources, and increase patient contact time with healthcare professionals. So it is looking things differently, and that's where I see innovation is about.
But it's interesting. So one thing that's come out from what you've said is time and kind of awareness that you had to step back and think about the challenges, because I think sometimes we rush ahead and we try and move on so quickly, whereas you've obviously, you're aware of the problems in the community that you serve. You've been thinking about how to meet their needs, and you've managed to plan an innovative way to do that. So, we do enable people to be in the shoes that you were in, don't we, to be able to do that? Yeah. Sorry.
So I think it is, part of nursing is reflecting. Yes, it is ingrained in us to reflect. And so it is reflecting on our work and how we can improve it for patients, for ourselves, and reducing the stress for everyone around us. Yeah. Okay,
that's really interesting. And you've mentioned kind of inequalities and looking after people to stay well, and that's a theme we'll come back to a little bit later on, because I think that's something we're all very aware has been so badly exposed by the pandemic. It is something we need to be more aware of going forward. Trudie, could I ask, you've got the thank you, Anjani. Trudie, you've got the role as UNISON's chair of our National Nursing Midwifery Committee, so you've got a good understanding of the national issues facing the workforce. How do we help them to be the kind of innovators and leaders like Anjani's talked about, if that's not too difficult a question?
Gosh, I think what you've just said about how we reflect on what we've done. I know from where we sat, Stuart, lots of big decisions were coming forward to us, weren't there, around the student nurses and how we would support them. I think we've learned lots of lessons around how people have diversified their practices. I mean, I can only speak from my local experience, but around the pandemic and innovations that have gone there, we had drive-through testing centres. Those drive-through testing centres have now changed. They are drive-through where people will come and get their bloods done, and those kind of things. So I think, that's so simple, and yet so many people have now, just coming into a regular blood test can have that done without, we know with our district nursing teams, it's very difficult for them to, by the time they've gone in and out of somebody's house with all their PPE, at least if we can get something. I know it feels a bit like a conveyor belt, but I think the patients are really happy because they're in and seen very quickly. From a national perspective, I think there's a lot of learning that we can feed into. I mean, I'm very fortunate, aren't we, from the team that we've got actually on our nursing sector, and we all know about how mental health has been really affected. So and I know myself from my role as a trade union rep, I support people all the time that are going through some kind of crisis. And I think that some of the things that we are forgetting, and it's absolutely amazing that we speak about the amazing job the student nurses are doing, an amazing job that our colleagues are doing with innovation, but we got a whole group of nurses that are at my age that are sort of coming near that retirement time, thinking, well, what am I going to do? How can I continue to grow? And those people that are shielding, they are those people, and they're thinking, well, how can I revalidate? So it's about, I think it is about the whole team as a whole, and as we as a national sector can ensure that we try and listen and support those people, really. Yeah.
So we've got some great examples of innovation, but we can't forget about the core details. We need the workforce to deliver it. Absolutely. And if we don't make the most out of supporting people and enabling them to give what they can, then I think we all know we're in real trouble, obviously, aren't we?
Mm.
Yeah.
Yes.
I'm interested in, the examples like your drive-through blood clinics and, all these other different innovations. There's been some really great ideas and ways that people have adapted during the pandemic, but there's also been some really awful ones that have come across my desk at times that we've had to kind of go to people and say, this doesn't work, or that's not safe. And there's been lots of talk about, we don't, the hierarchies are gone. We can drive change through so much quicker now. But there is a risk that comes with that, isn't there, of doing things that aren't safe or that patients or the public don't want or have negative effects. So, is there something there, and how are we going to pick the good ones from the bad ones? Partnership working, I suppose, is an answer. Sorry to answer my own question.
Yeah, I think that is key. That certainly has been my lesson, all the way through this. I would never have imagined that some of the decisions that I had been involved in, and some of the thinking, and you think, no, that really is not going to work. Some of the expectations, when they think, we're going to open up this new unit, and believe me, the staff in the area that I cover, they've been moved around from pillar to post. They've not known from one day to the next what were they going to be working on. Say, well, hold on a minute, you need to take a step back here. Everybody will do everything they can, but actually they need to be supported. They need to have a buddy, need to, all those kind of things. Because sometimes we just forget, there's human beings at the end of this, don't we? And they're focused on so much on the task, but not about how they're going to get the task done.
Yeah, and just like Carley said, that ability to check that someone's okay and are doing all right is so important as we go forward. I was dealing with a colleague recently who the unit they'd worked on had been really reconfigured, and basically the nurses that she worked with had been asked to work in a very different way during the pandemic, and they had done because they were faced with this crisis and they wanted to step up to the task. And they did really amazing things to change how they worked, but because of the way they've changed, it's basically become a new normal, and the expectation's just been they'll carry on with that. And now they're getting some pushback from management and people kind of saying, well, you need to do these things. It's now just expected of you. And they're kind of going, well, we did this because it was an emergency, but we didn't always want to be doing this. And I think it'll be really challenging if management don't deal with that kind of thing compassionately and make sure people feel rewarded for what they've done rather than taken advantage of.
Yeah, and that's a really good point. Stuart spoke about this a little bit earlier on. So as we know, a lot of our staff were redeployed, and they really stepped up and just did an incredible job. And a little bit earlier on today, I got asked, what are the qualities in nursing? And I think the really good thing about when you work as part of such a big team, what I would say is that, none of us are perfect. We've all got different personalities. And I would just say, embrace your strengths and bring them to the team, and then thrive off your colleagues' strengths as well. It's that working together that just makes it more efficient, effective. And I think it's just about always remembering that. It's how we kind of come together. And when Trudie's made some amazing points about innovation, it's a lot about how the team deliver those like new systems as well. So it is really important.
But I thought it was amazing so many times during the pandemic, the skills that people found that they had when they were forced to by necessity. Some of the times I was working clinically, and people were pushed way beyond what they would have wanted to have done if, and in many ways it was unsafe, but it was what had to be done. And the skills that people had on show suddenly to show some leadership, to make the best of the situation and cope with it and try and keep people safe. I'm really hoping a lot of people realize now those skills that they've got, and they can make the most of them going forward, but obviously that requires nurturing as well, doesn't it?
Yeah, absolutely. Yeah.
So question then, bringing in Joy and Carley, one of the big challenges that we're going to face is that, well, Trudie's mentioned this, we have a section of the workforce, many people that feel tired or exhausted or already planning to leave. I've spoken to so many people who stayed on in posts longer than they wanted to because of the pandemic, and who are now thinking, it's time to call it a day. We've got you know, fortunately some good news in that we've got record numbers of applicants coming in to study nursing and other healthcare professions, but they're a long way off qualifying, and in that interim period they're going to need a lot of support, advice, and, you know, the experience of those staff who are also trying to cope with all these other challenges. So how, given everything that's changed and all the innovation that's happened, how can we try and make sure that we train those students so that when they qualify, despite all those challenges, they've got the right skills and the right knowledge? Did you want to come in at that first, Joy, and then we'll ask Carley?
Yeah, I think it comes down a lot to all of the humanity skills and the humanity connection that we've been talking about throughout, is communication, advocacy, speaking up, having the confidence to speak up. And we're taught throughout our degree to use evidence-based practice to advocate for others. We're the most trusted profession. We should be applying person-centered care. And as Angelina was saying, we're a reflective profession. So if we apply those fundamentals, and for example, innovation doesn't always have to involve technology, and the wisdom of a nursing professional who's been in the profession 20, 30, 40 years, that's gold. And I don't think anyone should feel excluded because they're not using innovative technology or aren't bringing that new technology in, although I do acknowledge that it can be frightening to have to suddenly deal with that, but in a way the whole world has over the last year. So I think there's really good bridges there to reduce any alienation that doesn't need to be there. So from the students' perspective, it is a really challenging time. You go on placement, you see your nursing teams exhausted and under pressure, you see capacities, you see patients handed over during the changeover shifts when it shouldn't happen, and the nurses say please don't, but it gets done because there's pressing needs and the patient doesn't get greeted or welcomed as they should. You see all those fundamentals at risk and at threat, yet those are the fundamentals that keep us all safe and keep that wheel turning. And I think we just need to stick to the fundamentals and be compassionate and kind with each other, communicate, speak up, and make sure that people are given opportunities to speak up. Like, go to the student and say, how are you doing? Don't assume they're okay. Go to your nursing teams and ask how they're doing. Create space and time for empathy, all the things that we already know. Rely on the fundamentals. Technology is great, but it's a tool. It's us, the fundamentals, that's going to be the safeguard that's going to protect us through these turbulent times, and they are going to be really challenging. And I think communicating like this and staying connected and recognizing our families, our loved ones, our health, our well-being. Society knows how to protect the NHS, it knows more about infection, clinical risk. We now need to do health promotion, protect yourself, society, community by protecting your own well-being. We need to be educators, advocates, innovators, the whole works, but it all comes down to just simple humanity and connection, I think.
So the fundamentals, yeah, that's a good point. I think we can get too carried away with, we've got all this fancy technology now, and, you know, the ability to do more simulated practice and all these kind of things. Kind of like we said earlier, though, isn't it? It's not worth it if people don't have the opportunity to learn from it and reflect. And also, I think a lot of students, what they've been saying to us, Joy, as well, they felt disconnected at times, haven't they? And if they've been doing modules at home or they've not opted into paid placements, they've struggled. And we know, you know, student attrition is a real big issue. So if we can't get the students that are applying and turn them into nurses, then the numbers mean nothing, do they?
Yeah, and there's a huge risk. I mean, I've seen my peers have kept me going, and I know I've helped to keep them going. And I've seen great examples where that peer support, where it's just been so overwhelming, and the only thing to get you through is your peers, and those networks and resources that you build up around so important. But I do worry, you're seeing signs where new recruits in over the last year, 2020, they're exhausted from online learning over the last year, and they're exhausted at the end of their first year. I know the degree is tiring, but I think those extra pressures this year it's the uncertainty. Being in limbo is stress, and when your body's under constant stress, your immune becomes weak, you're exhausted, you're tired. We know all of these things as nurses. So prolonged stress and trying to learn and do a degree and support others as a nurse or a nursing associate, it's really challenging. So we need extra measures of human kindness and compassion to make sure we all survive this.
Yeah,
and unfortunately we may not get it from the government, so we've got to advocate for ourselves and make sure we keep being heard and keep pushing, because we will not be listened to otherwise.
Absolutely, and I think we're all very worried about, you know, students and how difficult that experience is. And it's not only qualifying, is it? But it's qualifying with the right skills, but also in a place where you feel like you can go into that first job and work and make the most of that job. So we do need to make sure people are well looked after. Thank you, Carley. Did you want to?
Yeah, it's just recognizing the difference that we can make as humans and how we are with each other. And with innovation, that's brilliant with the idea behind it, but ultimately it's a person, it's people who create those innovations. So it's like what Joy was saying, you know, it's the fundamentals. Like I always say as well in nursing, nothing is basic. Nothing that you will do for a patient will ever be basic. It's fundamental, and those things are so important. And I think it's just about putting the patient at the heart of everything, you know, and innovation means different things to different people. And I think from my perspective as a student nurse, I think it's really nice to have that inclusion with opportunities. I know obviously Joy does a lot of extra activities as well. And I think it's amazing when we can be included in that. You know, if you want those opportunities, then just recognising that students can bring a lot to the table. You know, often we have very good ideas. We can look at things with perhaps a different approach. But having said that, also it's about recognising, you know, some of our colleagues who are students might not want to do a lot of extra activities, and that's also fine. You know, there's no right or wrong. It doesn't make us, you know, particularly better nurses at the end. But I think it's really good for students to be given opportunities if they do want them. For me, I feel that to be included in opportunities, it helps me develop in my learning, which I feel really positive about, because it is important to I think, I mean, I always like to kind of develop my knowledge, because I think it's important for when I do qualify as the staff nurse next year. So I think it's just about recognising students can bring a lot to the environment.
Absolutely, yeah. And well, I mean, we talk about innovation, but your role, you've been a nursing associate, and that's an innovation, isn't it? It's a new post, a new way of doing things, and a new way of training people as well. You know, you worked as a nursing associate for just a short bit of time, did you? So just on that kind of side, how has that been? And do you think that's a way that we can try and overcome some of the issues we're going to have with training people?
Yeah, I mean, the nursing associate role, because it's still such a new role, and obviously it has, you know, divided opinion. My experience with it was positive, and I feel like it's kind of it's given me some good experiences that I'll take for when I'm qualified as a staff nurse, and make that transition for me quite smooth. But yeah, you're right. It's still such a new profession. But I think we're using it well.
There's been lots of positive experiences. Lots of people saying it's worked really well for them. And so, you know, it's another way that people can come into nursing, isn't it? As we go forward.
This is what I've spoken about earlier today as well, with the different routes into nursing. And it's important to mention, even when you do the apprenticeship route, you still need a degree at the end. You still come out with a degree at the end. And I think it's really important that nursing is, you know, a degree profession. And that we've just spoken about this in our uni tutorial, actually, that, you know, it's never just task-based. We always must understand the theory behind what we do, why we're doing it, patient safety. As you know, Stuart, I've got a lot of interest in clinical governance. So yeah, I just think all of those things are really important.
People can learn them all as they go, you know, doing things like being a nursing associate as well as, you know, yeah. And it's interesting, again, reflections. I know we're reflecting together, but you've all mentioned reflection tonight, I think. And that's important what you said there about it's not just being a task-based job, but you need to reflect on what you can learn from everything else and how you bring that to the care that you deliver to patients.
And of course, in nursing, in healthcare, it's such an ever-changing profession and environment. We are always going to be learning. And so I say this all the time, even 20, 30 years from now, I always want to be, you know, learning. And you do. I think it would be worrying if I got to a stage where I didn't want to learn anymore, or I didn't think I was learning, because that's complacent, and that I feel isn't a good thing. So I think learning is something really crucial in nursing, and it never stops, no matter what level you get to.
Always got something to learn, and I think we've all learned so much over the last year, and that is one way that we're going to have to overcome the new challenges. You know, we don't know how we're going to solve them at the moment, but we are going to have to learn as we go. So we're beginning to come towards the end of the event, and I've got one kind of last question, so I'll just pose it to all of you and see who wants to come in. Again, it's a difficult question. So not only have we got the new challenges of the pandemic, but before COVID-19 hit us, we'd already seen that life expectancy in the UK had stalled over the last 10 years. We were already seeing expanding health inequalities between different communities. And Gianni, obviously, you know a lot about that through your work and through your Mary Seacole Award. So it's not just about the challenges of COVID, but about dealing with those pre-existing problems. So how are we going to use what we've learned from the pandemic in terms of protecting and promoting the health of patients and the public? And maybe if you could specifically think about health inequalities, you know, how are we, those people who are experiencing the worst health, who struggled to get the right opportunities, how are we going to help them and use what we've learned?
Stuart, you used the word partnership. I would like to say, I would like to build on that, because as we are aware, the health inequalities and deprivation was there, and it just wasn't highlighted throughout the pandemic. So it is working partnership with the local council, because that's one of, and the social and economic side of things. So as nurses, I think we really need to be aware of these groups, this disadvantaged group, in supporting people, especially as we know people are homeless. People move around. We have people moving around from one area to the other, and they may not have the technology. So it is highlighting as nurses where people are and having that skill to identify. A simple one that I use in diabetes is that we tell people to reduce the carbs, right? But we need to ask the person, where are they getting their food? If it's the food bank, it's mostly high in carbs. How can we address that? So it is actually talking to people, working in partnership with all the different areas to address some of and reduce some of the inequalities that we find.
That's really interesting. Yeah, I mean, because obviously COVID has hit people who had poorer health much harder, obviously. So how do we address that underlying need? And nurses are obviously, and the whole nursing family are the people that are best placed to ask those kind of questions you've just talked about, Anjani, obviously. And one of the reasons the pandemic has affected us so badly was because our ability to manage public health had been so undermined by 10 years of austerity and underinvestment. So, you know, we've got a big challenge on our hands to rebuild that now. Did anyone else want to add in on that point?
Yeah, I think just inspiring younger people as well, and especially with regards to health promotion. It reminds me actually this conversation of my scholarship idea prior to COVID, and the idea was to educate the young people so that they can keep themselves safe. And because obviously I do live in the northeast, and yeah, there is inequalities. So it's, yeah, there was some really good points there. I just think it can be started, you know, for our young audiences. Yeah.
And you do a lot of that, obviously, in terms of you reaching out with your kind of going into schools and talking about coming into nursing, don't you? Sorry, you're still on mute, Carley.
Sorry, we're getting a lot of positive feedback as well. And I think, you know, if I'd had an opportunity like that as a young person, not only is it good for engagement, but of course it can be quite life-saving as well. So if you teach a young person how to recognise if a family member is having a hypo, things like that, you know, it can be life-saving. So I think just like looking after the whole community is a really positive thing, and that was one of my motivations of wanting to be a staff governor, because it's about how we put the patients at the heart of everything that we do, and also the community that we serve as well, at all ages.
Yeah, no, it's a big worry of ours and mine. I think that although early on in the pandemic there was huge amounts of talk about health inequalities and how it was affecting different communities, that it seems to have that very quickly the whole media focus on things can move on actually, and it might need to be nurses and the nursing family that drag it back and say, no, the pandemic's really exposed some really bad things here, and a very unequal society in lots of ways, and the way people are treated and the way their health is, and we need the investment and the skills to be able to do that. Joy or Trudie, just to wrap up, did you want to come in with any further thoughts?
Yeah, I just wanted to say briefly, I think if you look at even the panel tonight and the different facets of nursing that we're each working in, it's having that holistic approach from the political top-down level to the governance level to the staffing level to the new students coming out working with the patients, and where Angeline's working. And there's a very interesting author, Heather Henry. She talks about your social value and the way that society values individuals, people and resources, and the monetary focus in that. In a way, we may feel that without budget, money and resources, there's not a lot we can do, but the social value of our time investment and the value that we can save through our investment in time, maybe there's just an opportunity with what we've been through in the last year to really drive that different way we value and the different way we use our time and resources, to kind of feel that we're not helpless or powerless to bring about change. It is going to be hard because we're run by a government that is not prioritising social care, not prioritising the nursing working force and NHS frontline staff, and that's going to be an ongoing battle. But I do think we have a greater collective voice that can bring about changes that is not reliant on finance and budgets, but ultimately we are in one way. I don't know
Absolutely.
if I'm saying that in a roundabout way.
No, I think you made a great point that investment in change and improving people's health and in supporting the nursing workforce and the NHS to do that. I mean, nothing could show that more starkly than the cost of the pandemic. And, you know, for the sake of the millions that we saved by cutting public health, you know, cutting community nursing teams, cutting, you know, not being prepared to meet a pandemic, test and trace alone has cost us something like 38 billion pounds. And that, what a false cost saving that's all proved to be in the end. And particularly the cost, the money, well, what it's cost us in terms of underinvesting in the NHS and its workforce for the last, you know, 11 years that we now need to recover from. So I think it's a really good point. And I think the ICA and the International Council of Nurses and lots of other people are trying to use the pandemic now to make that argument that investment in the world's nurses and the world's nursing family is absolutely necessary to help us recover from the pandemic. So I think that's a really great point to round off on, unless Trudie, you want to come in and try and have the last word.
No, I totally agree. Totally agree with what you said. And I think the issue, perhaps like one thing I would say is that particularly where I live in the southwest of England, we rely very, very, very heavily on the hospitality industry, which is absolutely taking the biggest hit ever through what's happened. And I know for the innovations that we're looking at, particularly with the high levels of unemployment in our areas, that we're actually going to be looking at trying to bring on those people that will now need jobs and bring them into our workforce. And that's the way we're going to move forward and protect those and try and help those people that haven't got employment and live in those deprived areas.
Yeah, and obviously investment in training them and supporting them and giving them good jobs it pays the country back, doesn't it? So yeah, very good point. Okay, thank you, Trudie. We've had some really good comments on social media tonight and throughout the day, so I was just going to quickly share some. We had NHS Glasgow and Clyde, which is one of UNISON's biggest branches, saying, "Today we mark the contributions that nurses make to society. International Nurses Day is celebrated every year on the anniversary of the birth of Florence Nightingale. We are proud to support all of our nursing members, whether in hospitals or in the community. You all play a vital role in our healthcare system," which is very nice. We've got some really great photos if you want to have a look at Nursing the Nation 21 on Twitter of UNISON organisers getting out and speaking to nurses and different members throughout the day and the last couple of days. there was a couple of the good comments. I'm just trying to find them. We had a comment from Liz Twist, who is an MP, saying fab stuff from Unison to all of our nursing staff who've been on the front line during this pandemic. Thank you for your endless dedication, devotion, and your selfless contribution. And we had a really great picture shared of some different nurses at Sunderland Royal Hospital Paediatrics as well, saying thank you to all the nurses and the whole Unison nursing family from the fantastic team at Sunderland Royal Hospital Paediatrics Ward. So some really nice comments if you want to go and have a look on social media. So I'll begin to wrap up there for tonight. That's been a really, just a really interesting, fascinating conversation. And, you know, for all that we've spent lots of time talking, everyone feels like they spent so much time talking about COVID-19 and everything that's happened. I think you've all made a great point about the need to reflect and learn, and maybe we haven't had enough of an opportunity to come together, people who've all been involved in this, and talk about what we can learn from this. So there's been some really great contributions and some really helpful points, I think, about how we can empower nurse leaders and how we can try and overcome the challenges that's still to come. So thank you a lot to the team at Unison that have helped us organise the event tonight, to Val, John, Dan, Cleo and Richie. And thank you to our panellists, Anjani, for coming and talking with us tonight, to Trudie, Joy and Carley. I think it's been a really helpful and interesting night. So we'll close it off here. I don't know, feel free to give a wave and say good night, but we'll end it there.
Yeah, good night, everyone. Lovely to meet you all.
Bye.
Thanks.
Good night, everyone.
Thank you to everyone at home for watching in, and all of our nursing family, obviously, for everything that you've done. And we look forward to working with you more.